At the Loop Pro, we strip away the complexity from healthcare failures and get straight to the core lessons and recommendations that matter most. Each weekly episode gives you the essential information to help reduce harm, critical insights you can use, share, and apply. Let's jump into this week's episode where we're talking about a patient who was stuck in an ambulance for 2 hours. And please, if you feel this information could help someone else, please share it.
It involves an ambulance ramping incident with a tragic outcome. The report centers on a patient who waited in an ambulance for 2 hours. Wow. And during that time, their condition deteriorated significantly.
Oh gosh, that's a scenario that really kind of underscores those challenges, ambulance ramping and the potential consequences
Yeah,
of delays in care.
it is.
What makes this case particularly striking is that the handover from the paramedics to the ED staff was initially described as straightforward,
Right.
yet it somehow devolved into this 2-hour ordeal.
2 hours
Yeah,
is a long time to be stuck in an ambulance,
yeah,
especially when a patient's condition is worsening.
yeah.
I can only imagine the stress and frustration the paramedics must have felt.
Yes, that's right. The report actually highlights the paramedics' distress.
Oh, wow.
Watching their patient deteriorate in the back of an ambulance with limited resources
Right.
and a less than ideal environment for providing care.
It's heartbreaking. It raises so many questions about what could have been done differently. Now, the report doesn't definitively say that the delay directly caused the patient's death,
Okay.
but it does stress the need to investigate the potential contributing factors.
Okay.
And that's what we're focusing on today.
That's key. It's about understanding the nuances of the situation and identifying any missed opportunities or systemic breakdowns that might have played a role.
Yeah, and one of the major issues the report points to is communication breakdowns.
Yes. This is a recurring theme in these types of incidents.
Well,
The report highlights that while there was communication between the ambulance crew
right.
and the ED staff, it wasn't effective.
Okay, so it's not just about talking, it's about effective communication, making sure the right information reaches the right people at the right time.
Yes, that's right. The report reveals a lack of a structured communication system, leading to situations where vital information wasn't reliably getting to the people who needed it. Imagine a paramedic relaying a critical change in a patient's vitals, but that information gets lost in the ED chaos. This report cites several instances like that.
It's almost like a game of telephone gone wrong, but with incredibly high stakes. And I imagine the lack of clear documentation further complicated things.
Yes, that's right. The report found gaps in documentation, making it difficult to reconstruct a complete picture of what transpired during those crucial 2 hours. It raises questions about whether all necessary interventions were considered, and if the ED had a full understanding of the patient's deteriorating condition.
So we have a delay, we have communication breakdowns, and we have incomplete documentation. It paints a pretty concerning picture. But beyond the immediate issues, I'm curious about the broader implications. What does this case tell us about the systemic challenges that contribute to these kinds of events?
Well, one of the most significant takeaways is the cost of time. Those 2 hours represent lost opportunities for interventions that simply couldn't be provided in the back of an ambulance.
Even if the ED was slammed, as they often are, that time might have made all the difference.
Yes, that's right. While recognizing the strain on EDs, this case exposes systemic shortcomings exacerbated during high-pressure situations. It's a system-wide issue.
Right. And that's what makes analyzing these sentinel event reports so crucial. They offer a chance to step back from the chaos of the moment and identify the underlying issues that need to be addressed.
I completely agree. And the recommendations from this report are particularly insightful because they move beyond simply pointing out problems. They offer concrete steps towards creating real change.
So it's not just about identifying what went wrong, it's about providing a roadmap for preventing it from happening again.
Yes, that's right. And that's what we'll delve into next. The report outlines specific recommendations for improving communication, resource management, and early detection of deteriorating patients in ambulance ramping situations.
And those are the learnings we really want to focus on today, because for those of us working on the front lines, it's not enough to just acknowledge the problem. We need actionable solutions, strategies we can implement to improve patient care and prevent similar tragedies.
I completely agree. That's where the real value of this report lies. It provides a framework for turning lessons learned into tangible improvements in our practices and systems.
So let's dive into those recommendations and explore how we can translate them into real-world action.
The report It really emphasizes a system where everyone is aware of the status of patients waiting in ambulances.
Right.
Simple check-ins aren't enough.
Okay.
It calls for robust, clear,
Yeah.
and effective communication systems.
So we're talking about communication systems that go beyond just relaying basic information. We need systems that can accurately and efficiently convey the patient's condition, here they've received, and any changes in their status.
Yes, that's right. And thankfully, some hospitals are already exploring and adopting new communication tools
Okay.
designed to facilitate more effective information sharing
Okay.
between ambulance crews and ED staff. These tools are not just fancy gadgets.
Right.
They're becoming increasingly essential for patient safety,
Yeah.
especially when we're dealing with ambulance ramping.
Can you give us an example of what these tools look like?
Sure.
What kind of information can be shared, and how does it improve the situation?
Imagine a system where ambulance crews can seamlessly transmit real-time patient data,
Okay.
vitals, medications, interventions,
Right.
directly to the ED's electronic health record system.
Okay.
That eliminates a lot of potential for error
Right.
and miscommunication.
That would be huge.
Yeah.
It would allow the ED staff to make more informed decisions about triage, resource allocation, and patient care.
Yes, that's right. And it would help create a more continuous flow of information.
Yeah.
Rather than relying on fragmented updates that can easily get lost in the shuffle.
And the report also mentions the use of live tracking systems to monitor ED capacity and wait times.
Right.
How can these systems be leveraged to improve ambulance ramping situations?
Think of these systems as providing a real-time dashboard of the ED's operational status. They can alert staff to potential bottlenecks,
Okay.
allowing for proactive interventions before situations escalate.
So it's not just about reacting to a crisis, it's about anticipating it and taking steps to mitigate it.
Yes, that's right. These systems can help facilitate better resource allocation
Right.
and ensure that patients waiting in ambulances are factored into the ED's overall workflow. It's about having a more holistic view of the situation.
But technology alone can't solve the problem, right? The report also emphasizes the need for clear escalation protocol and a shared understanding of when to raise the alarm.
I completely agree. Having sophisticated technology is only part of the solution.
Yeah.
We need the human element too, like awareness,
Yeah.
the judgment,
Uh-huh.
the willingness to speak up.
So what does that look like in a practical sense?
It means having clearly defined criteria for identifying patients at risk, clear pathways for escalating concerns.
Right.
It also means fostering a culture where everyone feels empowered to speak up. If they see something that's not right.
It's about creating a safety net that catches patients before they fall through the cracks.
Yes, that's right. It's about recognizing that everyone on the healthcare team has a responsibility for patient safety.
For more in-depth information on this reportable event, check out the link in the description for the original article on our website. There you'll also find loads more resources to support patient safety. Remember, staying informed could save a life. So if you can please share this with someone who could benefit, you're helping us make